Welcome to our video. Today we're going to address some of the myths that we receive from patients. We have with us here a myth box. You can subscribe to it or send your myths through to it. We will try to answer all your questions. So my first question will come from, it says here, an irregular cycle indicates infertility. That is a myth. That is not true. An irregular cycle has to do with your hormones, not with your infertility. The most common cause of irregular cycles, and by irregular, we mean you skip a month or you skip 2 months before you see your periods. If your periods don't come on the same date every month and they come every month, that is not irregular periods. Please know that regular periods means that you see your periods every 21 to 35 days. It doesn't mean that on the 15th of every month you'll have a period. It simply says that you will see your periods once every 21 to 35 days. So irregular cycles could be an indication of hormonal problems, and that does not necessarily mean there's a problem with infertility. That myth is debunked. Right. However, if you jump more than 3 months without seeing your periods, please talk to your doctor or visit our website. You'll get more information about how to handle that situation. Thank you. Cheers. Alright, the next myth we have here is that periods are the same for everyone. No. It's not like that. Some women will see their periods every 28 days. Others will see them every 30 days. Others will see them every 22 days. So all of that is normal. What is normal for one woman might be abnormal for another woman. The only important thing is consistency. You should see your periods. The interval of your periods should be the same. It can differ by a couple of days, 3, 4, 5 days. That is fine. But no 2 periods are the same. The patients who are taking the prevention pill will have similar periods because the pill controls your periods. If you're not in the periods, your pills may not be 28 days. Your periods may not be 28 days. They may be shorter or they may be longer. So don't ask your friend for the length of her periods because yours might be different and completely normal. Cheers! Alright, the next myth that's in my hands here, it says that exercise during your periods is bad for you. Well, not exercising during your periods is actually bad for you. You can exercise anytime during your periods, after your periods, before your periods. Exercise is good for your health. Exercise is good for your hormone profile. Exercise is good for your fertility. Exercise is good for your physical, mental well-being. So, yep, go for it. Hit the road and run or go to the gym and enjoy yourself. Cheers. Another myth we have here is that a woman can get pregnant on any day of her cycle. Unfortunately, that's not true. There is essentially only one day in your cycle that you can fall pregnant. If you don't know that day, you're going to struggle. Alright? And your ovulation tracking is not always right. The best way to track ovulation period is to go to your doctor to do follicular tracking. They scan you and they see how your follicles grow, because we know that your follicles will only ovulate when they reach a particular size. And once they have ovulated, your egg is going to survive inside the fallopian tubes for about a day. So truly speaking, there's only one day in your cycle that you can conceive. All other days you can't conceive. The window is closed. The window of conception closes very quickly, lasts approximately 1 day. However, the sperms can last up to 7 days in the fallopian tubes. So we do not recommend that you have intercourse on the day of ovulation. Rather have intercourse on the days before ovulation, so that by the time you ovulate, the sperms are already in the fallopian tube. Good. Just. The next myth is that normal periods are usually painful. Now ladies, anything that is painful is not good for your health. If you exercise and you get pain, that's not good for you. If you've got periods and they're painful, they are not good for you. We accept that the first few years after your first period, you're going to have irregular periods and you're going to have painful periods. It's called primary dysmenorrhea. But thereafter, about 2-3 years after your initial onset of periods, you should not have painful periods. You might have period discomfort, but it should not be painful. If it is painful, get it addressed, see your GP, see your doctor for them to put you on the pill. And if the pills don't help you, see a doctor who can investigate you for endometriosis, because endometriosis we find it even in young girls. Our youngest patient with endometriosis was 12 years old. So it happens in the young, it happens in the middle-aged, it happens in the old patients as well. So painful periods are a sign that something is not right. And the commonest something is endometriosis, which affects 1 in 10 girls. So if you've got painful periods, go to our website. You're going to get more information about endometriosis and other causes of painful periods. Generally, fibroids do not cause pain. Fibroids cause heavy bleeding. Pain is caused by endometriosis and other problems. Yes. Please like our video and subscribe to our channel. See you next time.